Trump administration's new Medicare drug pricing plan, is this a bold move or just a distraction? The Trump administration is proposing and preparing for a new executive order to have drug prices in the US actually match that of other countries that are as equally economically stable as we are, economically stable, right? What this means in layman's terms is when drugs are priced, whatever prices they are in Canada, in Germany, and other developed countries like we are, that's the price that it should be in the US, right? The issue with this is number one, drug companies will not go for this, right? They cite that the financial downfall that things like this could have on their industry could stifle innovation, investors, the normal spiel, right? Like if the drugs are too cheap, they won't have money to go into research and development and innovation and get the investors that we need in order for disruption and innovation to continue in drug development. Point taken. They've been successful before in blocking this, and so this is circling back around. It's not a new issue. The other thing is that this is very interesting is this negotiation or this executive order covers Part B as in boy drugs, right? Drug B, so if you're not familiar with Medicare at all, Part B covered medications are medications that you have to go into a center or your provider's office to get administered to you. And those drugs usually are primarily chemotherapy drugs, specialty medications where you need a trained individual to administer the medication, or you need to be monitored as you receive that medication. So that's what this executive order wants to focus on. But the question that I have for you all about this and ambitious and bold moves like this, number one, it's encouraging because it means we're all on the same page that drug prices are absolutely ridiculous in this country. Wonderful. The second thing I have on this issue is this where our energy should be going? So if we all agree that prices are ridiculous, can we start with combating predatory PBM practices? Can we start there? Because if the administration agrees that prices are ridiculous, can they support us in going up against PBMs and changing these predatory practices in a way that everyone can benefit? Tell me in the comments. I really would love to know what patients as caregivers and also care providers, what your thoughts are on whether or not we could go after these two things separately or if all our efforts should be going right now into standing up to the PBMs. Meet me in the comments. Let's talk about it.